Again, another question that I'm sure every woman out there is wondering. How do you get something that's this size? First of all, how do you get it in? Well, you say you make a little incision.
Right.
How does this big thing go inside that little incision?
Right. Well, there are a couple of choices, and the implant type plays into that as well. The three basic choices are under the arm, around the areola, and under the base of the breast. And the saline is really good for under the arm. So you remove the scar from the breast and put it in a natural crease up high where you shave, a natural crease where your arm folds. You make a small incision, and that implant actually goes in empty. It's rolled up about as thick as my thumb, and there's a little tube coming out. So,
Oh, for goodness sake.
So we make a tunnel, and I use the endoscope, so I'm watching it up on the video screen, and I tunnel it under the muscle and get it situated, and then unroll it, and then we start pumping the fluid in until it fills to the maximum fill. And each implant has its own fill number. So, and then you pull the tube out, and it self-seals on that little valve.
That is amazing.
So that's pretty cool, yeah. The gel comes pre-filled from the factory. There is no valve. It is what it is. But as you can see, they are squeezable, and
Yeah,
so
but still.
they can shape. So it's just kind of that magic of plastic surgery. We make a small incision. Generally, I will put those in under the breast at the bottom crease where your bra hits. It's well hidden because you're not going to see that. Typically, the breast has some hang to it. And it does require just a titch more of an incision, but maybe an inch and a half, inch and a quarter.
That's it?
That's it.
And this can go in?
Right, and I just kind of work it in through there, and it's one of the trade secrets that we have.
And a magician never tells his tricks.
Absolutely not.
I don't think I want to know anyway.
You probably don't.
And is there any other method?
One other that I don't use is a transumbilical. And that was popularized by a couple of guys I met over in Atlanta. And really, it's just such a long way to go. And you have to use a trocar and somehow use a pusher to push the implant up under there. To me,
If it ain't broke?
Well, yes. I think that it's a legitimate way to go. For me, I guess I'm too much of a control freak. I really want it right where I want it. It's too far for me to, I need to be able to get it right in the right spot so that I'm satisfied that it's going to be perfect every time.
Why go the distance when you can just, I agree.
Absolutely.
What else do we need to know as women that are contemplating this type of procedure? Is there anything we do need to be nervous about?
Well, like any surgery, there's risks. And we talked about the sensitivity. One of the more common things that women who know other women with implants, and sometimes they get hard, and that is a scar form. The implant doesn't get hard, your body doesn't, your breast doesn't get hard. The scar around that implant can contract. But we can treat that. We can go in and strip it out. It does mean more surgery.
What do you mean the scar around it? Where you put it in?
No, inside the breast,
Right.
Your body will make an envelope of a scar around this implant. It'll make an envelope. And that's called a capsule, and everybody gets that. If the capsule is soft, the breast remains soft. If the capsule is flexible, it remains soft and flexible. If the capsule gets either thicker or starts shrinking and contracting, now that may feel stiff.
But what causes that?
Sometimes it's just a reaction by your body. It's almost like your body is saying, hey, this is a foreign object. The same thing would happen with my watch. Or one of these bottles. If I put it under your skin, your body would make a scar. It's a foreign object. Your body knows it's not you. And in my simple terms, it's protecting the rest of the body by walling it off. Similar to an abscess. It tries to contain. And for some people that shrinks. And so they may get firm. It's about a 10%, 10 to 15% over your lifetime. So it may not happen ever in 85% of the people.
Well, how long will they last in your body?
A very good question. They will probably outlast you.
Really?
The common myth or rumor is that you have to change them every 10 years. If there are no problems, you leave them alone. You do not have to change them. But like any other mechanical device or man-made object, this could leak, the valve could leak, you could be in a car accident and rupture them.
What happens when that happens?
Well, if it's saline, it will go flat within usually a day or two.
But nothing will hurt you.
Nothing will hurt you. The body absorbs.
Right.
The body absorbs the saline because it's the same fluid we put in your IV.
Right.
Okay? The gel, because of that capsule, typically that gel is going to stay right there. In fact, most people do not know that their silicone implants are ruptured.
And they're safe like
Yes.
that because it won't leave the area?
Correct. Correct.
So they would never have to go and have another one put in?
Well, the party line from the FDA is that if we know it's ruptured, we probably should change it. Their recommendation currently is that about every 3 to 5 years, a woman should get an MRI, which is like the CAT scan with the
Right.
magnetic resonance, because that is the gold standard in deciding whether an implant is ruptured, because you can't feel it, it doesn't change shape necessarily, and routine mammograms will not necessarily show you that a silicone gel implant is ruptured. So it is contained in your capsule beneath your breast, and it stays right there. Very safe procedure, very common, one of the most common things we do. The surgery itself takes about 45 minutes. Recovery, most people are back to work within 5 to 7 days, usually back to exercising within a couple of weeks. I tell people don't expect the real soft look to be there for a couple of months. Usually within the first couple of weeks the chest is very swollen, they're a little full, a little artificial looking, the muscle's swollen, the breast is swollen, you're sore. Usually by about 4 weeks they're starting to calm down and relax a little bit. By about 2 to 3 months, kind of what we see is what we get at that point. We're another common question, do I have to massage them? And my answer is yes at the beginning.
So because they don't stiffen up?
Yes, and mainly because that muscle right here, it runs this way, is hugging your ribs and has been your whole life.
Right,
We're going to put an implant underneath there.
right.
And so that muscle really wants to get back to the ribs, but it's going to have to stretch, and muscles don't give up easily.
Yeah.
It takes them a while to stretch.
Wow.
But once they do, then the breast is soft, very natural looking, very natural feeling.
I have 2 more things that I want to ask. What about women that have not had children yet, that might want to nurse after?
Sure.
Should they stay away from something like this until after?
Absolutely not. What I tell most women is if they are actively trying to become pregnant, it probably makes sense not to have a surgery, because breasts typically change and sometimes get a little looser, a little saggier after nursing. But the young person that is not in a relationship where they're ready to have children, there's no reason to wait. The way I typically put the implant is under the muscle.
Right.
You can put it just under the gland as well. It does not have to go under the muscle. Me personally, that's my style. I think it gives a more natural look in the V-neck. And when you're behind the muscle, you have not interfered with the breast ducts. My 2 favorite incisions, under the arm and under the breast. The periareolar is okay. You have a little more risk of injuring the milk ducts that bring the milk to be delivered to the child. So I like to stay away from that and just dive under the breast and stay away from the gland so that it is still functional. Back to the question of that sensitivity, even if you lose that sensitivity, you can nurse with that breast. That breast will still show you when you're cold. You just don't feel it up here because that sensitivity may be different, but it is a functioning, working breast. So really, unless someone's actively trying to get pregnant, I say if you want them, go ahead. It should not interfere with breastfeeding.
Well, what do you mean by if they're trying to get pregnant? What would that interfere?
Well, you might be pregnant by a month and not know it yet, and we're putting you under anesthesia. And there I think there's some risk.
Yes.
Plus, immediately, if you immediately became pregnant the next week, as your
Right.
breast is enlarging with milk, you're also trying to recover from surgery. It's
Right.
just logistically
Bad timing.
probably
Yeah.
not a good time.
Thank you so much for tuning in and checking it out. This is Dr. David Klein with Renaissance Plastic Surgery. Hasn't it been enlightening? I mean, I've learned an awful lot. Thank you.
You're welcome. It's fun.